Well, hello everyone. Bonjour à tous. Before we begin, I would like to acknowledge that the land on which we gather is part of the treaty lands and territory of the Mississaugas of the Credit. For thousands of years, Indigenous peoples inhabited and cared for this land and continue to do so today. Welcome, everyone. My name is Dr. Helena Jaczek, and I'm the Member of Parliament for Markham, Stouffville. I'm joined today by the Honourable Mark Holland, Federal Minister of Health, Dr. Kathleen Ross, President of the Canadian Medical Association, Teri Price, Health Advocate with important lived experience, and of course, Heather McPherson, President and CEO of Women's College Hospital. And I'd like to extend a big thanks to Women's College Hospital here in Toronto for hosting us today. We appreciate your tireless commitment to your patients and their care. And I just want to mention that 50 years ago, I was a family practice resident here at Women's College Hospital. And I had both my children here in these hallowed walls. And in fact, I was on the active staff until 1982. And I know that sounds a very long time ago, but seriously, this hospital has meant a great deal to me through the years. And of course, it looks very different from the way it was 50 years ago. So we are pleased to be with you for this important announcement, which will help empower patients' decision-making and improve health services across Canada. Canadians deserve secure access to their own health data, and this Act provides a plan to make that possible. Please note that there will be an opportunity for media to ask questions following the announcement. Veuillez noter que les médias auront l'occasion de poser des questions après l'annonce. Now it's my pleasure to introduce the President and CEO of Women's College Hospital, Heather McPherson. Heather is a highly recognized healthcare executive with extensive experience in clinical, academic, and health system leadership. Heather has worked to establish clinical programs and services that close the health gaps for patients, not only at Women's College Hospital, but throughout the province. She was also the leader on the implementation of an electronic health record here at Women's College, which is why hosting this event here today is so meaningful and fitting. Heather McPherson.
Thank you, Dr. Jaczek, and good afternoon, everyone, and a special welcome to our distinguished guests. We're so thrilled to have you here, welcome you here for this important announcement at Women's College Hospital. Never before has so much information been accessible and interconnected instantly for all of us. With a few quick clicks, we can do our banking, order our groceries, communicate with friends and family, or see the latest news headlines and share endless amounts of information. In healthcare, although we are at the forefront of science and technology, in many ways, the digital revolution has been slower to progress. Across our system and right here at Women's College Hospital, a tremendous amount of work is being done to integrate innovative tools and digital solutions to enable patients to access their health information and for that information to be shared safely across doctors' offices, hospitals, and in the community to improve patient care and health outcomes. I'd like to share a few of the advances that we've made at Women's to connect patients directly to their information and to the larger health system. Like many hospitals, we have a patient portal known here as My Health Record. It gives patients access to their health information online at any time from anywhere. Patients are able to view their visit summary after their visit, which was discussed during or done during the visit, and a post-visit instructions, complete video visits with care providers, and view test results. To ensure that referrals are getting where they need to be and responded to in a timely manner, we are currently streamlining and digitizing the entire referral intake process. One of its many benefits is the ability to track data in real time to make sure primary care providers are receiving timely responses to referrals and patients are receiving timely access to care. More than half of our referrals are now digitally processed, translating to about 1,000 a week. By the end of the year, we'll have all of our referral process digitized. And finally, like many hospitals across the province, Women's has integrated the Ontario Lab Information System, giving healthcare providers access to lab test orders and results from hospitals, the community, and public health labs. As patients move across the health system, the integrated platform makes viewing patients' current and past results easier and enables treatment decisions to be made at the point of care. These are just a few of the ways that we are harnessing the power of technology and digital innovation to connect all of us to the important health information we need to deliver the best patient care and empowering patients with their comprehensive health information at their fingertips. We know Canadians, patients, and healthcare providers alike from coast to coast to coast will benefit from today's announcement and enhanced access to their healthcare information. Thank you.
Well, thank you so much, Heather. And now it is my honor to introduce to you today the Honorable Mark Holland, Minister of Health. Mark has been doing some incredible work in the health file, from launching pharmacare and a new dental program to signing important bilateral agreements with each and every province to ensure access to our public healthcare system for all Canadians. Ladies and gentlemen, please join me in welcoming my colleague, Minister Mark Holland.
Merci, Helena, pour tout votre travail. C'est vraiment un plaisir d'être ici avec vous. Merci, Teri, aussi, pour l'occasion d'être ici pour une annonce vraiment importante pour notre système de santé. Vraiment, c'est quelque chose qui va transformer notre système de santé. I start because you think of this, how do you connect people to health data? When you think of data, it doesn't sound, particularly important. I can try to talk to people in my constituency or across the country about how important health data is, and they kind of gloss over and think that I'm on to some nerdy topic. But the truth is that data saves lives in a very real and appreciable way, and it has the power, perhaps greater than anything else, to transform our health system. We had the opportunity before this announcement here today to hear from Teri Price and to see her incredibly moving film, Teri, about the loss of her brother, Greg. I want to start by saying I'm so sorry. We failed Greg. The pain that you and your family went through is entirely avoidable, which makes the tragedy so much greater. To lose somebody to a disease like cancer is impossibly hard. To lose them unnecessarily, I can't even begin to imagine. But you give that loss a purpose, and you do it a great honor by being here today. And I don't want to take that story. I really want us folks to hear from you. This isn't going to fix everything that Greg faced. We have to be honest, there are other problems in that story, but a very important piece is interoperability and the way that we share data. And, doctor, you were just sharing a story about a patient where you didn't have the information that you critically needed 24 hours in advance. And if you had had that data, you would have been able to save that patient. And I think very powerfully telling us the experience you had afterwards of knowing that you could have saved somebody and that life was lost, how hard that was. So these are the very real stories that are at stake when we talk about data. And that's why the legislation, the framework legislation that I was able to table in the House of Commons today is so critically important for our health system. And it builds upon the conversations and work that we've been doing as health ministers across this country to set aside our differences and say, we have to come together and we have to make the transformation that our health system needs so that people like Greg, we don't hear stories like that anymore. And in Charlottetown, we created a digital charter. We set out the opportunity to create a framework and a foundation for the legislation that's here today. That legislation isn't going to be a panacea. It's not going to fix everything, but it sets that framework so that we begin to have regulations and work directly with provinces and frankly, build upon the dollars that were put into health agreements across the country that placed a priority on health data, making sure in the first order that patients can have access to their health information so that they can view it and so that the health agreements make important progress forward in that regard. But this legislation will also help take the blindfolds off of practitioners. It's a little like trying to fly a plane without instrumentation. We wouldn't ask a pilot to get in a cockpit if they couldn't see what altitude they were at or what the speed of the wind is. And yet we ask physicians to go in and see patients, depriving them of critical information they need in order to be able to make those decisions. That has to end. The adoption of this legislation is an essential foundation to what needs to be done, but we are absolutely committed, as I know my health partners are, and we just had an opportunity for me to talk with all health partners on this issue a couple of weeks ago, to making sure that we close the gap. The fact that only 35% of physicians can share information outside of their offices is entirely unacceptable. The fact that fax machines are still used is entirely unacceptable. Even if you don't think of stories like Greg's, and I think all of us do, imagine the frustration as a physician to have to be relying on forms and faxes and duplicative processes instead of spending time with their patients. And of course, that's going to drive people to not want to be in practice. It's also incredibly unjust and dangerous to ask patients to retain in their minds health information, to remember, what was I supposed to do? Who was I supposed to see? What's the next step? So for that information to be integrated, to have that interoperability is, I think, absolutely essential. The other thing that we know it does is it paves the way for a very different future. That by getting data right now, by integrating that data, we can see patterns in that data, and we can start thinking about deploying artificial intelligence to be able to say, you had a visit here, you had an issue here, there was another issue here, be able to connect those dots, to be able to see that perhaps you have a rare disease, or perhaps there's some underlying condition that would be not obvious when you look at one piece of data in isolation. So in simple terms, this both empowers providers and patients, and it's long overdue. It's part of our commitment to transform the health system more broadly. And Helena and I are so committed. And Helena was a former health minister, so I know you do this very well, on top of being a physician here, that the investments we're making in those 26 bilateral agreements across the country to deal with the crisis of the now, the work that we're doing with health data now and interoperability, the work that we're doing in pharmacare, the work that we're doing in dental care, to be looking upstream and asking how we can prevent, because of course we know 70% of chronic disease and illness is entirely preventable. It may not be as obvious a story, but there are so many people who are getting sick and dying unnecessarily because they weren't able to manage their diabetes, or because they were in a circumstance where they couldn't get the critical medication that they needed, or they didn't get the oral health care that they required. So on all levels, it's a call to action. Coming out of the pandemic, we have a workforce that is exhausted, that entirely too much has been asked of doctors and nurses and personal support workers. They deserve to see from political leaders the level of work and attention that they put in during the pandemic and those impossibly dark days and long hours. They need to see us setting aside our differences and moving on solutions. And I think today is an important proof point on that. So I was very proud to table that legislation in the House of Commons today. And I think at this time, Helena, I'm supposed to be turning it over to Teri. And that's very appropriate, because I think, to put this in context, no human in Canada, I think, could tell us how important it is to get this right more than Teri Price. Teri, who started Greg's Wings in honor of her lost brother, as I said, was forced to face a horrible trauma. Not only losing a brother, but knowing that it was preventable. One of the most treatable diseases in testicular cancer. She's here to share her story. Teri, I thank you for your advocacy, your work, and your presence here today. Ladies and gentlemen, Teri Price.
So my brother, Greg, was a mechanical engineer. He was somebody who was super intelligent. He loved to learn. He loved a challenge. And at 30 years of age, he had very little interaction with the healthcare system up until that point, and then was diagnosed with testicular cancer. It was for more than 400 days from the first time that he talked to a doctor about some of the symptoms to the point where he had surgery, and he died a few days later in my parents' home of a blood clot. After Greg's death, as a family, we really wanted to understand what happened, and we really wanted to know if there was things that we could do to help to prevent it from happening again. Fortunately for us, we were introduced to the Health Quality Council of Alberta, who did an investigation, which we were invited into the boardroom with that team and learned a lot through that whole process. Like many Canadians, I think, we made a lot of assumptions about the healthcare system. We assumed that the clinicians that were involved in Greg's care had full access to all of the information that they needed in order to make safe decisions. And through the journey of the investigation, we learned that that wasn't the reality for that care team and for Greg. And so a few years after we had the opportunity to create a film, which is called Falling Through the Cracks, Greg's story, which we have been using to spark discussion about the need for change in healthcare for the last 6 years. We've done more than 600 screenings of the film and are incredibly grateful for the opportunity and all of the discussions that we have had after the film. It's given us an opportunity to learn from other people's experience and to reinforce the knowledge that Greg's story isn't unique. There's elements of the gaps in care that Greg experienced in many, many patient stories. And really a lot of the discussion we have does touch on aspects of access to information. And so we've continued to work and have been extremely grateful to be able to have met a number of experts in the field and people who have been willing to share their knowledge, and I believe have a very strong shared collective commitment to progressing this forward. And so we're really excited about being able to collaborate across the board, to learn from others, and to really focus on some of the things that we hope to see in the future of our healthcare system. If we want our healthcare system to be safe, we need the people who are making decisions in the healthcare system to have access to the information so that they can make safe decisions and for the condition for it to be possible for safe care to happen. If we want patients to have teams that surround them and support them through any kind of diagnosis and through health throughout their lives, we need the teams to be able to share information and communicate effectively. And if we want a healthcare system that's innovative, we need to eliminate some of the barriers that exist so that the people who are committed to and are solving problems now have the runway and the ability to implement the kinds of solutions and ideas that will make a difference for the healthcare system in the future. So we're really grateful for this first step today. We know that legislation is one component, but we really do believe that this is a foundational piece that needs to happen. It's critical. And we're excited about the potential to continue to collaborate and look forward to working on this. Like Greg, I'm not afraid of the hard work and the commitment that's required for this, and really thank you for the opportunity to be included in the session today, and to Minister Holland and the whole ministry team who has been working on this so far. And we're really looking forward to be able to continue to work together on this for the future. Thank you.
Thank you, Teri. You do tremendous justice to Greg's loss. We really appreciate you being here today and sharing the story. And yes, absolutely, Joe Vauzin, who's here, who's phenomenal with the health team. I'm really fortunate to work with an extraordinary team at Health Canada, who I want to recognize. I really get to be the voice of so much of the work that they do, and I appreciate that. Are going to be continuing to work very closely with you. And of course, the key as I get ready to introduce our next speaker is also privacy. And one of the things that's so important of this act is making sure that we continue to make sure the existing legislation's in place to make sure that we actually enhance security and enhance the protection of data as we move forward. Well, the next speaker is somebody who is a tireless and relentless advocate for health in our country. Dr. Kathleen Ross is president of the Canadian Medical Association. She is a family doctor for a very, very long time in British Columbia. In fact, my director of communications was just noting that she delivered her partner and brought him into this world. And she has been absolutely instrumental in my journey as health minister over the last year, providing critical advice and guidance of where we need to be going as a health system. Her tireless advocacy is a big part of the reason that we're here today. And with that, it's my great pleasure to introduce Dr. Ross to speak to us today. Thank you.
Well, if I didn't feel old when I got here, thanks. Thanks a lot. So it's really my pleasure to stand before you on this, what I think is a historic day. On behalf of the Canadian Medical Association, I represent the physicians and medical learners across Canada. And the CMA is committed to multiple actions that will improve patient care, improve the work that we do as providers, and certainly help to make our system more effective and efficient. Access to data is critically important. It is important that we have access to safe and effective sharing of information, but I recognize that data is also a barrier, and it is a hurdle that we need to come over every single day. Access to data is foundational, as you said, Minister, absolutely. It tells us how we operate in our system. It gives us information that we need to deliver care as physicians collaborate across the teams, critically important, Teri, and how patients have access to their own information so we can empower them to be part of their care team. The tools like electronic medical records provide us with overwhelming amounts of data that's often presented in a disorganized phase. It can be difficult to access or actually impossible to access and share, and that absolutely increases our burden as care providers, makes it harder for us to do our jobs, and it actually does take away valuable time that we could be spending with patients. You stated data saves lives, and I could not agree more, absolutely. But lack of access to data, that interoperability piece, is causing patient harm today. This is a critical patient safety issue. And this is a story that I know well, and we've heard many stories shared today, but I always share this one because I think it's really impactful. A patient of mine in my maternity clinic had an ultrasound done in the community. She was sent to the hospital because of an abnormal finding on that ultrasound. I didn't have access to that information, so I assessed her clinically, and I had to risk sending her home. Next day, I still had to phone to have the result faxed to my office, and only then could I act and provide her the care that she needed. Thankfully, in this case, the outcome was good. The radiologist made the right call. The patient followed the instructions, but that lack of access to timely information could have had significant negative outcomes for this patient and her unborn child. I have little doubt, and I've been saying that all year, my apologies, but I have little doubt that a lack of interoperability, that portability of data, is going to remain fragmented without some regulation, some particular requirements and some standards, and that is to the detriment of patient care. We do have pockets of ad hoc interoperability across the country that could be role models, but we need that national connectivity that can help transform our healthcare system for the better as we move into the future. And we are still such a long way from our ideal state in so many ways, but having accurate information that can be exchanged in an easy, consistent, and effective fashion for both clinical use, for policy making, and for other uses that we may need to improve our system, whether that's locally or nationally, is a big part of it. Together with our partners, the Canadian Medical Association has been working with Infoway, with the Royal College, with the College of Family Physicians of Canada, and other thought leaders across Canada on a health information, so a digital health interoperability task force that is going to help us facilitate timely access to information, critical collaboration where that's needed for transitions in care, patient access to care, and health system planning. At the Canadian Medical Association, we recognize the critical importance of legislation to ensure data is interoperable in our healthcare system, and we fully support the announcement that our government has made today as an important critical step in the right direction. We know this will be a change for the better, and I really look forward to seeing the positive change that this has for our healthcare system, for our patients, and for those of us providing care. Thank you. Merci, miigwech.
Thank you so much, Dr. Ross, and all of our speakers. So this concludes the speaking portion of today's event, and I will now pass the microphone over to the moderator for any media questions. Thank you.
Okay, thank you. We'll begin the Q&A with any questions from the media here in the room. Merci. Nous commençons la période des questions et réponses avec les médias ici dans la salle. Are there any questions? Y a-t-il des questions? Okay, there are no questions here in the room. Il n'y a pas de questions ici dans la salle. So we'll pass it to the Zoom for any questions there. Thank you. Alors, nous allons passer au Zoom maintenant pour toute autre question là-bas. Merci.
Thanks, Lori. If you're a journalist on the Zoom and wish to ask a question, please use the hand-raising function. Si vous êtes journaliste sur le Zoom et vous désirez poser une question, veuillez utiliser l'option de lever la main. So we'll go to our first question, which is from Émilie Bergeron de la Presse canadienne. Émilie, à vous la parole.
Oui, bonjour. Yes. Sorry, I was waiting for the moderator to unmute me. Oui, bonjour. M'entendez, Monsieur Holland?
Bonjour.
Oui, OK. Je n'étais pas sûre que vous m'entendiez. OK. Donc, dans votre projet de loi, il y a une disposition qui permettrait à votre gouvernement d'agir avec un décret, un Order in Council, pour forcer une province ou un territoire qui n'aurait pas mis des mesures qui seraient jugées suffisantes en place pour les forcer à implanter votre projet de loi à vous, au fédéral. Comment vous réconciliez le fait que déjà vous annoncez que vous pourriez avoir recours à un décret ou à un Order in Council tout en collaborant, selon ce que vous dites, de bonne foi? Comment vous réconciliez les deux éléments?
Oui, alors aujourd'hui, quand j'ai présenté le projet de loi aux chambres de communes, c'est une continuation de la conversation avec tout mon homologue, avec toutes les provinces et territoires. Et je peux dire qu'il y a beaucoup de coopération. Et le projet de loi est là pour toutes les juridictions où les projets de loi n'existaient pas. Et ça, c'est le cas pour les grandes majorités de juridictions partout au pays. Mais heureusement, et avec le charte digital, le charte pour l'utilisation de données à Charlottetown, on a créé une entente généralement sur les questions de l'utilisation de données. Mais après ça, on a beaucoup de conversations. Plus récemment, on a une réunion avec tout mon homologue, avec une conversation sur les questions de le donner. Et il y a un sens de beaucoup de collaboration. Mais alors, les choses peuvent changer avec le temps. Et c'est vraiment important de s'assurer qu'il y a une approche fédérale avec un esprit de collaboration, mais en même temps qu'on peut continuer de s'assurer qu'il y a une approche de connectivité. Parce que, alors, s'il n'y a pas de connectivité, il y a un coût absolument énorme. Ça, c'est évident dans le témoignage de Teri et sa frère Greg. Et ça c'est les raisons pour lesquelles ça existe. Mais à mon avis, ce n'est pas nécessaire dans la situation actuelle parce qu'il y a un grand esprit de coopération.
Donc, ce que vous dites, c'est on se dote d'un décret, mais on pense pas on pense pas avoir à l'utiliser. Alors, pourquoi l'avoir mis dans la loi, dans le projet de loi, pardon? Et l'Ontario et le Québec ont déjà des législations. Est-ce qu'on doit comprendre qu'elles vont systématiquement être exemptées?
Ce n'est pas une question d'une exemption, c'est une question de collaboration. Et oui, il y a des juridictions comme l'Ontario et comme le Québec où les projets de loi existent déjà. Et l'idée est de l'utiliser, leur législation avec les projets de loi dans le champ actuel. Mais c'est essentiel de s'assurer à l'avenir parce que c'est possible pour avec une élection pour un gouvernement de change et dans une situation comme ça, pour Greg et tous les autres patients, de s'assurer qu'on a un système connecté et qui peut fonctionner bien. Ça, c'est essentiel. Il y a beaucoup de travail de faire. Et ça, c'est la raison pour laquelle c'est là. Mais dans un contexte actuel, il n'y a pas besoin vraiment de l'utiliser, ce pouvoir-là.
Merci beaucoup. Next question comes from Anya Karadiglia from the Canadian Press. Please go ahead.
Hi, thanks for taking my question. I wanted to ask if you can give us an idea of how fragmented the system is, kind of like a bigger picture. We heard this morning that there's about 30 providers, like the dominant providers, different ones operating in Canada. So, how fragmented is the system currently when it comes to health data?
Well, I think, globally, we have a significant challenge, which is the rapidity with which technology changes means that there are a lot of different systems that are deployed, often that aren't communicating with other and often don't have interoperability. So by having common standards, it means that as new technologies are deployed, that interoperability is present. The backwards facing elements are more difficult because we have legacy systems, and a lot of those legacy systems contain enormous amounts of data, and it's very difficult and costly to port that data into new systems. But the end result of it, like a lot of systems all over the world, is an enormous amount of fragmentation. And I think that it's extremely important in this space, to speak a little bit to the other point, that there be federal leadership. Who else to coordinate all the provinces and territories but the federal government? And so we've been approaching this rigorously in Charlottetown with the conversation that we had establishing a digital charter, in my direct conversations with my colleagues at the provincial and territorial table, to say, how do we work together to deal with what is a very, very fragmented and challenged system? And, I would encourage, anybody, if you get the opportunity, to watch the film that Teri and her family worked so diligently to put together. You can really see it in a very visceral way and in an extremely emotive way, to see how these different functions aren't speaking to each other. But, I'm talking to physicians who tell me, look, I got to sometimes send the same form 4 or 5 different times, 4 or 5 different ways. Just to give you a sense of that and how ridiculous that is, and what a administrative burden that puts on them, as well as the danger of, whether or not that is just sitting in an inbox somewhere because there's an enormous amount of paper and there's no way to digitally prioritize.
And for my follow-up, do you foresee pushback from any of these companies, especially given that one of the things that the legislation will do is prohibit them from charging very hefty fees to transfer data?
Well, look, if you're a company and you have the opportunity through working for a health system to collect data, then you have a corporate responsibility to participate in sharing in its use. And we have companies that are rightfully, I don't fault them at all. It's wonderful that they're making extraordinary profit by being involved in in life sciences. But the data that they're gleaning is often being paid for by public funds. And therefore, I would think, just as a measure of corporate goodwill, that they would want to make sure that they were sharing and not getting in the way of that, blocking that data, or trying to profit from siloing that data. Because by doing that, they're putting people's lives at risk, and they're using the benefit they're getting from participating with a public system then to injure that same public system, which is nonsensical to me. So I don't expect that if they'll be making those arguments, they'll be making them too vociferously, because I don't think they'll have a very sympathetic audience.
Thank you. And our next question is from Christy Kirkup of the Globe and Mail. Please go ahead, Christy.
Hi, good afternoon. I'm wondering, Minister, if you could speak to perhaps what you see as the greatest barrier in kind of the current scenario of data sharing that will be addressed by this legislation.
Well, it sets a framework. Like, I have to be clear, we have more work to do. But I think we should talk about, Kathleen talked about the end state. And I think it's important to declare clearly and fully what we want that end state to be, which is that physicians have access to a system that is able to share data securely and instantly, that is able to make sure that the physician has the full picture in front of them of their patient's history. So they have all the data, all the flags, all of those different information points, because oftentimes you can't know in an individual situation. Certainly you can't know as a patient. And that's where a lot of this is put on right now is, and we see this in Greg's story, where one piece of information, Greg doesn't understand how important that is at a different doctor's meeting. It's not Greg's job to hold that information or to have the medical knowledge to know why one visit connects to another visit. We need a health system that puts that in a dashboard where, and then frankly, when things are urgent, when they really need attention, that has a way of automatically bringing it back to the top and poking the system and telling them that it's there. And then to come from the patient's perspective, when we're talking about an end state, that you would be able to view your entire patient information, that would be digitally available to you, so that when you're given a referral or you're asked to follow up in a particular way, you're not reliant on your notes or your memory for that. That's immediately present. And that you can walk into a pharmacy and that information, again, is relayed so that there's connectivity all through the path. And that then sets the foundation, and I talk about this importantly, for in the future, the application of artificial intelligence. Because artificial intelligence is the ability to be able to scan massive amounts of data and see connections that no individual human can make. And the more rich our data set, the more data that's available, the more it's able to make those connections and understand perhaps connections that we would never otherwise see, to be able to see how one symptom expressed in a particular way among many different patients relates to an illness that we didn't realize that symptom was indicative of. So it is empowering a future that is so important for our health. There's an immediate need now, but it also unlocks a really important future for the use of data, and to do so securely so that patients can be assured that their data is protected.
And just as a follow-up, Minister, one of the things you've talked about today is also the need for standards. Why is it important for there to be standards in place? And do you expect that you'll need assistance from the provinces and territories in order to be able to get, to move forward on achieving those standards?
Yes, absolutely. And a lot of these systems are obviously developed internationally. So we have to be looking at what sort of our international trends and standards, so that as new technology is developed, we don't have a Canadian outlier, then therefore suddenly we can't apply that technology to our circumstance. So it's incredibly important that we talk with our colleagues on that. But it's also incredibly important, absolutely, to have continued conversations with the provincial and territorial colleagues. And I think, look, there's one of two ways this thing can break generally when it comes to health. We can look at our model of health today, where we have so many different jurisdictions, and it can be a major impediment to progress, because we can look at it and say, well, one jurisdiction's doing this and one's doing that. Or we can say, by working together and setting that aside, not only can we can actually make it an incredible advantage. We can be more nimble, more adaptable, more able to deploy solutions at a quicker rate, because we have smaller distributed jurisdictions with smaller sets of governance, if we get the other issues out of the way, which is what I think Canadians expect us to do in these conversations. And the other thing that becomes then possible, because frankly, to transform our system from a crisis-based system into a system that's based on prevention and being upstream and avoiding illness, that's going to take a lot of innovation. And in that innovation, we have to take chances. And I don't mean risky chances here. I mean data-informed, scientifically validated chances to say, this looks like it's going to be a good solution. And we can then deploy that in different jurisdictions and try and see how it works. Frankly, I look at what we're doing on pharmacare as a great example. We deployed a solution in PEI. We're able to evaluate that in a smaller market and see how it works, and then able to take that learning and think about it nationally and scaling up pharmacare across the country, how it may or may not apply.
Thank you. There are no more questions, so that will conclude today's news conference. Thanks everyone for your participation. Any additional questions can be directed to Media Relations at Health Canada. La conférence de presse est maintenant terminée. On vous remercie de votre participation. Si vous avez d'autres questions, n'hésitez pas à communiquer avec le Bureau des relations avec les médias à Santé Canada. Merci et bonne journée. Thanks and have a nice day.
Thanks. And I'll just close by thanking everybody for coming here. I know all of you are critical stakeholders in our journey together. And whether or not it's Joe or it's Jill, who's our Director of Policy there, please stay in touch with us. We look forward to continuing to work on this and really appreciate you taking the time to be here today. Thanks so much.